Okay, so in this set of lectures, I'm going to talk about some of the behavioral interventions, specifically skills training, behavioral self-control training, and incentive-based approaches that involve social or environmental reinforcers. Your readings will cover monetary-based incentive programs. All right. So I think this specific lecture is going to cover mostly skills training, although it may leak into another one. So there are actually 6 steps in teaching clients skills training, and this can this can be done in a couple of different ways. So skills training has actually been done both in group settings and in individual sessions. And it can be done either didactically, not sure this is a word, but whatever, in which case you present the information like a lecture and sort of provide demonstrations, and eventually you'll give clients opportunities to practice skills. Um, but I'm not sure and I think that's an approach that works pretty well within, or really well within, a group setting. But I tend to prefer a different approach, and that is to take the approach that, or at least to make the assumption or start from the assumption that clients already know the skills. And so rather than lecturing at them, I prefer to elicit the information from the client using kind of a Socratic approach. So asking a series of questions and helping the client to sort of provide the information about the skill, or at least provide what they know about the skill. And this is really helpful, one, because it does actually help you to see what the client already knows, but also it doesn't insult their intelligence then. It actually starts from the assumption that they are knowledgeable as opposed to the assumption that they're not knowledgeable. So the next step then would be or the first step would actually be to provide a rationale for the training. This is really important because, again, you're teaching some pretty basic skills, and so the client needs to understand why it is that you're teaching them these things. And of course, we know that clients are much more motivated and to do something if they understand why they're being asked to do it. And also, it can be really useful. It can be helpful to instill hope in the client that things can get better, right? So if you can tell them, here's what's going on, here's why I think you're having a problem here, and this is how the skill can help you, that can really help to instill hope in a client that things can actually get better. And I think that the best way to do this is to really tie it into clients' experience. So you can do this in one of 2 ways. You can either start with a situation that the client has talked about in the past, for example, saying something like, well, you've mentioned that you've been having some problems at work with your boss. You feel like he is taking advantage of you. Let's talk a little bit more. Let's talk a little bit more about this, or do you mind if we talk some more about this? Because I wanted to see if I wanted to provide you with some information that I thought might be able to be helpful for you in this situation. That was about a mouthful. The alternative is that, when you start your session, you often ask the client to talk about their week, how things went, and if they bring up a situation that's kind of relevant to the skill that you're wanting to teach them, then you can work from that specific situation. And like you would learn in motivational interviewing, it's always a good idea to sort of ask permission as opposed to just assume. So something along the lines of, I'd like to talk to you about a skill that might be helpful to you in dealing with the situation. Would that be all right? And then you would really explain how you think that the skill that you're planning to teach this client would be helpful to them for coping with the identified situation. Part of this rationale can involve helping the clients understand that recovery involves coping with a variety of challenging situations, some of which are anticipated and some of which are going to be unanticipated, right? So, they may be able to tell you some of the situations that are going to be hard for them, but they may not be aware of all of them. And so skills training is going to give them the tools that they're going to need to handle these types of situations. And if we buy into the idea that recovery is essentially a natural process of cue exposure and extinction, it's really critical that we give the clients the tools that they need to be able to cope with the cues that they're encountering, so they can resist using drugs in those situations, so that they can eventually disassociate drug use from those triggers, and that will eventually help them to extinguish, or at least suppress, those craving responses, right? So, we've talked about this, that the process of extinction is kind of a multi-stage process, that the client is going to experience spontaneous recovery of those craving experiences. So they have to be able to resist use over and over and over again in a variety of different situations in order for that extinction process to happen. And it's important to help the client understand how skills training will help with that process as well. So the next step is to actually describe the steps involved in the skill. So each of the skills, in the Treating Alcohol Dependence book that either you have bought or I'm sharing with you, lists out a set of steps that are involved. So the nice thing about this is that rather than having to learn the entire skill all at once, we can kind of teach each of the steps individually, give the client the chance to try out the steps, and then ultimately kind of use them all together in order to deal with the situation. You want to make sure that you go over each step with the client and describe what's involved with that step. So thinking about something like assertiveness, for example, you might actually start with talking about different kinds of communication styles, asking clients which one are they more likely to use, passive, passive-aggressive, aggressive, or assertive, and then talk about assertiveness as a communication style that helps them to get their needs met without necessarily stepping on the needs of other people. And then talking about things like stating their needs directly and concretely. So for example, if the issue is that the client wants the spouse to take the garbage out, rather than saying, the garbage is really smelling bad today, or I've taken the garbage out every day this week, both of which are really ineffective strategies, a more direct and concrete method might be, it would really help me out if you could take the garbage out a couple of times a week, right? So that's a much more direct way. And so as you're sort of talking through the skills, you can kind of give examples. And that actually kind of links into the next step, which is modeling the skills. And in fact, what I've just done is sort of demonstrating that process. So since you need to model each of the steps anyway, you can actually kind of combine the explaining the steps and the modeling the steps simultaneously. So, stop and think about what you want, be direct and concrete about what your needs are, and then demonstrating specifically what that would actually look like for the client. A really good idea as you're doing that to link it to the situation that the client has brought up. So it makes it more concrete, more meaningful, and it really helps the client to begin to think about how they might go about approaching dealing with the situation. Once you've gone through and described and modeled each of the steps that are involved in the skill, the next step is a role play. In this case, and I'm sorry, in that modeling process, a third way that this could be done would be by role playing, in which you as a therapist play the client and the client is someone else, and then you sort of demonstrate through a role play what worked, and asking the client, what did you think about that approach? How did you feel? Did you think it would be effective? All right, the next step would be role playing. In this case, you're going to have the client try out the skill in session and recognize that this is a low stakes situation, one where there's very few consequences for doing it wrong or even for trying the skill in the first place. And so in this case, the idea would be, and again, we're going to link this step with the next one in providing constructive feedback. You're going to want to help the client to recognize what they did well and to be able to identify things that they could do better. And again, try to keep it positive, right? Focus on, this is the things that you did well. Here are some things that you could improve on, rather than talking about, here's the things that you didn't do well, right? But you guys should be good with that. You might even start by asking the client what she or he thought what they thought they did well and what they thought they could improve, as a way of kind of getting them to sort of reflect on their own performance. The idea behind this role-playing and constructive feedback idea is to give the client multiple opportunities to practice the skill until they can demonstrate mastery in this low-stakes situation. And this is important because you want to have them feel at least somewhat proficient in using the skill before they have to try it out in a more higher stakes, or in a more high stakes or a higher stakes situation. one of the really useful things that can be done here is to ask the client how it feels to them um, as they think about using these skills, or as they sort of imagine themselves using these skills in the identified situation. This is a really critical part of the conversation, because sometimes failure to use a skill in a situation doesn't have anything to do with a lack of skill and has everything to do with a lack of motivation. All right. So oftentimes when I do this in person, I will sometimes ask a student, hey, could you go get me a cup of coffee? And about half the time, the student is about to get up and walk out the class to get me a cup of coffee. Um, on the other hand, if I ask a student, hey, could you loan me your car for a month? You'd have absolutely no problem saying no to me, right? And part of it is to sort of think about, why might it be harder to say no in some situations than in others, right? Loaning me your car for a month is an unreasonable request, and so it's fairly easy to say no to that request. Whereas asking you as a student to go get me coffee, well, it sounds like it could be a potentially reasonable request. And because it sounds reasonable and there's potential consequences for saying no, right? I'm your teacher, you want me to like you, you want me to grade you well. You might actually be more inclined to say yes, even though you don't want to, right? And so the inability to say no in that situation has nothing to do with with skill and everything to do with motivation. And it's really important to sort of understand, what are the factors that are interfering with the clients using effective skills in different situations, right? So maybe the reason that they don't ask their spouse to take out the garbage is because they're afraid that it's going to cause conflict and they don't want to get into a fight. So really asking them, why is it harder to say no in one situation versus another, and asking them, what are the consequences of using this particular skill in the situation that you've identified. This can actually lead to a really important conversation that extends well beyond the skills training process. Once the client has demonstrated mastery of the skill, then you're going to want to assign homework and have the client practice the skill in the real world. So again, be sure that the client has demonstrated mastery of the skill. This is a really critical piece. And then probably want to have the client try it out in a low stakes situation or a lower stakes situation before they use it in a high stakes situation. So for example, if the issue is a problem with the boss, maybe trying the skill out at home with a spouse where there are fewer consequences associated with either using the skill or doing it incorrectly would be a good place to start. Have the client report back on how it went, have them critique their own performance, so that they then have had some opportunities to see what it's like to use this with someone who doesn't feel as safe as their therapist. And then once they feel confident, right, because self-efficacy is a really big part of this, then they can try it out in the higher stakes situation. But after each time they use it in the real world, it's really critical to debrief the experience with the client. And what I just sort of want to remind you is that in those treating alcohol dependence books, all that information is in there. So it will provide you with a rationale that you could give to your client. It will list out the steps and give specific examples for each step. It'll have suggestions for role plays. And then it also has some reminder sheets and tip sheets. So a therapist tip sheets is something that you can bring into session to remind you what those steps are so you don't have to remember. And also a worksheet or a homework sheet for the client that they can take home in order to sort of begin to practice the skills in the real world, so that that can help with the process of transitioning the skill from the session to the real world. All right, so I'm going to stop this one here and then tape the next lecture addressing the remaining content for this